Hi, my name is Teresita Uribe. I am a registered nurse and currently a student at Purdue University studying for my bachelor's. And this week we had to watch a video called Chasing Zero for an assignment, which focused on how nurses or doctors can avoid causing medication errors and how these medication errors have impacted other people's lives. One of the reasons I was really impacted by this video is because a lot of the stories that were discussed involved children. And as a mom, I couldn't help but to think, what if this was me? What if these were my children who were administered a wrong dose because a nurse was tired or exhausted, overworked, mentally distracted? And therefore, my mom mode kicked in and I just couldn't help but to think about my children. But the second reason why I was severely impacted by this video is because I have worked for 11 years as a nurse in long-term care settings, and I have seen where there is a lot of room for improvement. And in long-term care, there are many facilities that do not have like Pyxis machines or ways to distinguish between two different medications. A lot of times you don't have a computer, so a lot of the MARs are paper charts, and you quickly look at things, but there's no alerts or side effect alerts, or this medication cannot mix with this medication. And therefore I have seen myself where some errors have been made and where there is a lot of room for improvement. I personally saw a situation or witnessed a situation where one of my coworkers was a new grad and went to assess her patient, noticed that her blood pressure was lower than the norm or her regular blood pressure, and still continued to administer all her medications and didn't think about what medications would contribute to continuing to lower her blood pressure. This patient unfortunately did pass, and this nurse to this day still recalls the situation and has learned that she has to not just count on looking at the MAR, but actually being knowledgeable about each and every medication to be able to properly administer it. And it's just something that I have stuck with. It has stuck with me, and I know she has to this day, and I didn't spend like 5 years, has been impacted by this every day. But I think that there are many different ways in which we can help to reduce risk for harm. And everyone has their opinion, everyone has their own personal experiences, and sometimes some of these discussions do cause some debate, but I feel that one of the main things that we can do as nurses and is support each other. I think that we need to improve our support system and be able to discuss amongst each other with our boss, with our coworkers, and just say, hey, you know what, today I'm not mentally prepared. Today I'm exhausted, and know that I have voiced what I am feeling, and hope that they can take that into account to either help me out by giving me more support or having me maybe stay at home. Even hopefully nobody abuses this, but stay at home and reduce the risk of potentially being distracted and causing harm to a patient. And I think that we can all contribute and support each other and reduce risk for harm to our patients. Thank you.